I have a background in aerospace medicine. I worked for the Air Force for 20 years as an aerospace specialist. That's where I started hyperbaric training. We treat obviously decompression sickness and problems associated with that. I see a lot of paraplegic patients, both quadriplegic and paraplegic, that we treat with wound care. Primary benefit of hyperbaric medicine is the introduction of a high source of oxygen that permeates through all of the tissues readily and easily during the treatment. That process helps initiate new blood vessel growth. So when we're talking about injury, difficult to heal wounds, most of those difficult to heal wounds are in areas that do not get enough circulation, and we can reach those areas. It also decreases the inflammatory response and helps reduce the injury that can occur from inflammatory diseases alone, or the delayed in healing effect that inflammation causes. Should you recognize symptoms associated with decompression illness, the immediate treatment, immediate transport to a hyperbaric facility is as important for the Diveheart community as it is for any other diver. The freedom of movement, the transfer of fluids by gravity, the loss of the gravity effect, being able to expand your lungs, being able to expand your muscles, all of that has got to have a tremendous benefit for somebody that's been limited in mobility. The typical wheelchair-bound patient, their biggest risk is for pressure. Diving relieves all pressure over the entire body at the same time, and the more you can dive, the more healing power you have just from that alone. What I love about diving is the freedom that it gives you, the floating in space. And if you can imagine a patient that's been restricted in mobility to a wheelchair that can now get out and see his body as being whole again, and that's an elation that I can imagine for myself. And with that, it helps us all imagine the possibilities.